I am Dr. Anoop Kohli, Senior Consultant at Apollo, a neurologist, and I take up the topic of epilepsy. As you know, epilepsy is a well understood disease, at the same time a disease with a lot of lack of understanding. Basically, an epileptic attack is an attack of loss of consciousness, altered consciousness, or an involuntary movement or a jerky movement of the part of the body. In itself, we believe that if you treat for a particular while, the epileptogenic area of the brain, as we call it, which is nothing but where you get the electrical currents from, will subside, and a lot of patients will get off epileptic drugs. There is no taboo as such. Most epileptics who are controlled are considered normal for education, for normal office jobs. There might be restrictions for a while on driving and other things, but there's a lot of social stigma to it. But epileptics are normal people, and some very intellectual people, which people know, I don't have to repeat, have been epileptics. If you would like to understand it broadly, epilepsy could be generalized, which could be running in families. So a person may have epilepsy for a few years in his childhood or in his teens, and for 3 or 5 years he's on drugs and then it's gone. But there can be epilepsy of another type, which could be because of damage to the brain, or sometimes an infant with a very high fever may burn a particular circuit inside the brain. Now that, when he grows up, might give rise to epilepsy of a different nature, which you call as temporal lobe epilepsy, to make it very, very simple and brief. Now these are epileptics which require anti-epileptic drugs for a longer period, and this is also the segment of people who might benefit from surgery if case they are refractory to multiple drugs. You can't be giving a person drugs for a lifetime if you have a particular part of the brain which can be operated. So that's where epilepsy surgery comes in. A lot of people think surgery is an option, like cardiac disease, it's an option. It's not an option for everybody. It's only an option where you can localize the problem in the brain in a particular area, and it's possible to remove that without causing sufficient or unacceptable damage to the rest of the body. A lot of changes have occurred over the years. Almost every year we have 1 or 2 new drugs which have a promise in controlling epilepsy. So more and more people have controlled epilepsy and can have normal lives, professional, social, personal, whatever you may call. Since it's not a very unusual disease, like 1 or 2% of the people would have it at some time in their lives, either for a short period or for a longer period. The awareness is extremely important, and if you have epilepsy, you probably have to meet a neurologist or an epileptologist, as they further classify themselves now, and get treated. Beyond that, of course, there's a lot of dogma which I would not like to talk about, but and more people are accepting it. I see a few young people where someone has got, but she or he is a software engineer, and they understand each other, so that social stigma goes away because they understand this person is normal. And there are issues of epilepsy along with pregnancy, but if you are not well controlled, then you continue to be on drugs, because to have a seizure while you're pregnant can be more injurious to the fetus than the drug may cause it. So actually, if you have drugs, and I've got people where I could not put them off at least 4 drugs at the time of pregnancy because it was just not possible. Well, the risk would increase by 2 or 3%, but it's not a complete no, and you have to monitor them. So far I have seen success, but yes, the best would be to wait a little longer. If you can get the patient off the drugs, then pregnancy is safest. In fact, any medication, even a antibiotic given during pregnancy, should be well thought of. So in cases of pregnancy, I'm just diverting from the topic, one may like to control the epilepsy if it's of the type that after 2 or 3 years it gets controlled. If it's not controlled, then keep him on the safest combination. Keep the child or the lady basically matters, the mother matters, because this drugs will circulate in her body. So you would like to keep her on what is known as the safest combination for the fetus, for the baby. And then of course you can monitor. Most of the times we can pull such things apart, though families are very anxious. Their gynecologists would say complete no to it, but when you have to take one, then you go on a proper combination and see to it that you pass that 8-9 months properly. And likewise, one more child. But epilepsy does not get transmitted except those which are familial types, and the familial types actually are the ones which go for 3 or 4 years and they go away at a particular age in your life. It could be a childhood, it could be a teenage. The other ones, because of injury, because of infection, meningitis, whatever, they are not transmissible because they are related to one episode of your life. So they are not genetic as such. So one must differentiate between the two. With modern medications, and drugs which are more tolerated, do not give dizziness, do not give side effects. One feels more fulfilled in managing a patient of epilepsy with multiple tools than we had before. So if I meet an epileptic, when I see one, I often see a good news, and this is what I'm saying, that it's curable. Let us remove the bias. They are all employable. There would be some safeguards here and there. Just because you might have a seizure at that time when you're driving or you're swimming in the pool, that's the only thing you might like to avoid. But otherwise, the scene of epilepsy now is much better, and there is the International Organization of Epilepsy, International League Against Epilepsy, and where more and more data is collecting, newer drugs are coming in, and people are getting stabilized, even getting off the drugs after a certain period of time. Thank you so much.